Madam Chair, we are still too shy of quorum, but we do have confirmation that we should have sufficient folks attending today. So if we could just give it a couple more minutes, that would be wonderful. Thanks for everybody for your patience. I don't know about you all, but that's one of the tricks with these back-to-back Zoom meetings. It seems like there's no built-in comfort breaks and everybody's always a couple minutes behind by this part of the day, right? One runs into the next, which runs into the next. So
For sure.
Hang in there for a second. We used to all walk from meeting to meeting together, right?
I think those Zooms are great because you don't have the travel time.
I agree.
Now it's been interesting with kind of the clash of going from all virtual to hybrid now, because then we do have travel time for some meetings, and at least our productivity, and I'm sure yours as well, increased dramatically during the pandemic because we can fit in so much more without having that kind of downtime between meetings where we're just moving. But now trying to keep up that pace and allow for the for the travel time has been challenging.
Madam Chair, you now have quorum.
Oh, great. Well then, good afternoon. Good afternoon, members of the MAG Human Services Technical Committee. This meeting is now called to order. This meeting is being recorded and live streamed on YouTube as a way for members of the public to participate. So please state your name when you're making a comment or asking a question, and I will ask that you keep your microphones on mute when you are not speaking. To begin today, I'd like to give an update regarding the leadership of this committee. I have agreed to serve as chair for 2023, and our colleague, Melanie Dykstra from the town of Gilbert, has agreed to serve as vice chair, and I'm very much looking forward to working with her. And we are both thankful for your continued participation in this work, and we look forward to a great year ahead. Further, we have two new individuals joining us today. Are they both here already, Kelly? No? All right.
I expect them both, though.
Good. Well, hopefully they'll be here and they'll have an opportunity to introduce themselves and share a bit more later in the meeting. But spoiler alert, Seth Dyson with the City of Surprise and Kathy Chang with Maricopa County are going to be joining our committee, which I think are two wonderful additions, and I'm really excited to have them here. So with that, we'll go ahead and begin the meeting with a roll call of members.
Okay, thank you, Madam Chair. Renee Benavides. Karen Bishop.
Here, City of Chandler.
Thank you. Kathy Chang on behalf of Jacqueline Edwards. Seth Dyson. Autumn Grooms. Jerry Wahardo. Jerry. Please let the minutes show that Jerry is present. I believe her computer's not functioning properly, excuse me. Eliana Guindino. Susan Hallett.
Yes, I'm here.
Thank you, Susan. Mary Lynn Kasanick.
Here.
Thank you. Rachel Sanders.
Here from the City of Buckeye.
Thank you. Kristen Charlotte. Vice Chair Melanie Dykstra.
Present.
Thank you. I'm going to go back to Kathy Chang on behalf of Jacqueline Edwards. Oh, I thought I saw her on there for a second. And Madam Chair, Christina Panatescu.
Present.
Thank you. Did I miss anyone?
Kathy's back. I think she's trying to get her sound to connect. Oh,
Hi, Kathy. We're just completing roll call. So I'm going to say your name one more time. Kathy Chang on behalf of Jacqueline Edwards. No audio, but I saw fingers, so we're going to count you. Thank you for being here.
awesome.
Back to you, Madam Chair.
Thank you. Our next item is call to the audience. This is the opportunity for the public to comment on items that fall under MAG's jurisdiction, but are not on the agenda, or that are on the agenda for discussion and not for action. So are there any members of the public could submit written comments via MAG's website 1 hour prior to the meeting? Kelly, do we have any written comments for this item?
Madam Chair, we do not have any written comments for this item or any others on the agenda today. Thank you.
Thank you. Our next item is the approval of the October 13, 2022 meeting minutes. Does any member of the committee have a question or an edit to the minutes? Hearing none, is there a motion to approve the minutes?
Melanie Town of Gilbert, make a motion to approve.
This is Susan Hallett with City of Phoenix. I'll second.
Awesome. So we have a motion from Melanie and a second from Susan. Can we get a roll call vote, please?
Yes, absolutely, Madam Chair. Let's see. Karen Bishop.
Aye.
Thank you. Kathy Chang on behalf of Jacqueline Edwards.
So I figured out my technology. Quick question for you. Quick question. Am I allowed to vote on a meeting that I didn't attend?
Amy is shaking her head yes, so I'm going to say yes, you can.
Okay, aye.
Thank you very much. Jerry Guajardo. Susan Hallett.
Yes.
Thank you. Mary Lynn Kasanick.
Yes, even though I wasn't in attendance either.
Thank you. Rachel Sanders.
Aye.
Thank you. Vice Chair Melanie Dykstra.
She made the
Sorry, I
motion.
lost my mouse. Yes.
Thank you. Chair Panatescu.
Yes.
Thank you. Did I overlook anyone? The motion passes. Thank you, Chair.
Our next item is a presentation on regional affordable housing efforts. Amy St. Peter, Deputy Executive Director from MAG, and Kelly Taft, Communication Director from MAG, are here to present.
Great. Thank you so much, Madam Chair, members of the committee. I believe IT has our presentation, and Jeremy, if you could just bring that up, please. As that's happening, we want to make sure that you saw an email come out earlier this week. And that was in regard to an affordable housing training that is available for free on March 7th at 10 a.m. Ooh, not that one, please. It's affordable housing one. And that training is it's still not us. Sorry, we're having some technical difficulties. There we go. So that training will feature a number of different speakers from throughout the state, including our very own Mayor Weiss. He is the mayor of Avondale, but also the chair of our MAG Regional Council, Councilmember Mark Stewart, who is with Chandler, but he's also the chair of our MAG Human Services Community Initiatives Committee. The basis of this training is featuring a report that's coming out from the Vilas Health Foundation called Promising Housing Practices. They are featuring case studies from throughout the state, and they're on a range of different practices, strategies, tools, tips regarding how do we make more housing available to folks at a broader income level. So we're really talking about affordable rents and mortgages, and communities are being really innovative. They're using a variety of different tools right now, including co-locating services. So the City of Surprise has a great model underway where they'll have senior housing at their new community center. We're looking at various loan strategies. There we go. Thank you very much. So there's really something for everybody, and we hope that you'll be able to join us at that training. Again, it is on March 7th at 10 a.m. It is free and it is a webinar. The basis for that was really identified by all of you. We surveyed you as our member agencies to determine what kind of capacity you'd like to build around affordable housing and what topics would be of interest to you. And promising practices, best practices, those were just number one on that list. So we're very excited to be able to offer that. That training is being made available through the Affordable Housing Collaborative that's part of Arizona Community Foundation. And we're excited to feature the Vilas Health Foundation as our lead partner. So all of this work, probably all of our work in general, really is a team effort. It's a group effort. And this next presentation really speaks to that as well. So we've been really fortunate to be able to partner with Home Matters to Arizona and their very talented consultant in Javelina to be able to develop a public education campaign around affordable housing. This is one of the action steps that's included in Pathways Home. If you recall, our MAG Regional Council approved Pathways Home, which is our regional homelessness action plan for local and tribal governments. That was approved in December of 2021. And one of the action steps is the development of an affordable housing campaign with the goal of increasing acceptance of affordable housing. So Kelly Taft on our team, our communication director, will be co-presenting with me today. We started working on that campaign right away. And then last year in April, we started working with Home Matters to Arizona. We fully combined our various campaigns and our efforts. And what you'll see today is the results of that collaboration. So we're excited to be able to offer this to you and want to thank you for all of the input that you provided up until this point, and really would love to partner with you, particularly as we get ready to launch this campaign just in the next month or so. So if you have questions, input, ideas at any point throughout the process of the presentation today, please don't hesitate to go ahead and jump in. We'd love to continue this dialogue with you. We can go to the next slide, please. So in thinking about a campaign, there's a number of different elements. And today we'll be talking very specifically about visual identity and the name of the campaign. Those are relatively small components of it compared to all of the other elements that go into having a successful community campaign. So throughout our efforts, we've been really working in each of these areas, but today we'll be focusing just on those two. We can go to the next slide, please. But first, I'd like to ground this conversation in the why and the what. So why are we having this campaign? And it's really providing a place where every Arizonan has a place to be at home. And doing so, and in having a home, they're really empowered to live stable and purposeful lives. Everything really generates from having that home. And we see the dire impact of people when they don't have a home and how their lives are no longer stable and how they're not able to contribute in ways that they would really like to. And so what we're trying to do through this campaign then is really twofold, is building those champions. It's cultivating champions in every sector, in every corner, in every community, so that we can help to change the narrative. It's hard to develop a campaign around something that we can't say. Affordable housing is a term, unfortunately, that has developed a lot of baggage around it. Very often people have a very specific and often negative idea of affordable housing as a very specific kind of housing or model of housing, as opposed to affordable rents and mortgages. So we're wanting to change the narrative, because people are more likely to push back when they see this as something that's negative and something that might hurt their community, their home, their ability to live a stable and purposeful life. I think people will be much more accepting when they realize that everybody needs a home and everybody can be empowered to have a more stable life if they have access to that home, and one that meets their needs on an ongoing basis. We've seen costs for housing just go through the roof. We recently completed our point in time count and talked to people living on the streets who said, I could pay my rent when it was $400 a month, maybe $700 a month. Now it's almost doubled and they can no longer pay it. And for many of us, if our rent or mortgage were to double with not a lot of notice, we would be strapped. We would have a really hard time paying for that, and we might not be able to pay for that. So we're very focused on housing homes that meet people's needs and that are sustainable for that long term. We can please go to the next slide. Excellent, thank you. So in talking about this campaign, particularly because so often the narrative, the discourse across our country has become so divisive. So how can we develop a campaign around around a topic that is sensitive, that does have baggage around it, in a way that really empowers people and helps them to feel good about this topic, helps them to feel good about it, helps them to feel energized. And so when we share the campaign name with you in the visual, this is what we're trying to achieve. We're trying to help people, inspire them to feel certain things, and we're trying to prompt them to think certain things. And so, and looking at the to feel column is very positive. It's warm, it's inclusive. There's still this sense of urgency, but it's not one that's alarming. You know, there's different ways that we can approach any conversation. We want to invite people into this conversation, not scare them into this conversation. And then in terms of that thought process, then, so we really want people to recognize that this affects everybody. We all want affordable rents and mortgages. Not everybody will say, yes, I want affordable housing in my community, but everybody wants affordable rents and mortgages in their community. So again, we're trying to change that narrative. We're trying to impress upon people that this is a topic really that impacts all of us, but it's doing so in a non-judgmental way. We're not pointing fingers, we're not blaming, we're just saying, hey, everybody really needs access to safe, affordable housing or affordable rents and mortgages, and how can we do that in a way that benefits the entire community and really includes the whole community. So if we can go to the next slide, please. So the name, they say, you know, a rose is a rose by any other name. And like, well, no, not the case, at least not here. So the name really makes a difference, because the name is how people initially engage with the campaign. So we put a lot of thought into it. So I'd like to spend just a few minutes going over the process to develop the name, and then give you kind of the update on the name and where we eventually landed. A number of you might have been involved in the development of the name. And so we want to make sure that we're honoring your feedback and circling back with you about the results of that feedback. So if you can go to the next slide, please. So this has been a fairly involved process. All of this work has very much been data-driven and very focused on community engagement. And so we conducted a lot of research on this. We looked at different campaigns, groups that were working in very similar spaces or adjacent areas. And then looking at how can we categorize that? Are they achieving the same kind of look and feel that we would want to on this campaign? And what can we learn from their efforts? And then from there, Javelina initially developed a list of 64 different options. And we took a look at all of those, and we were able to drill down into which names do we think will be the most viable, which names really help us to inspire those feelings and those thoughts that we had just talked about before. So we're able to present a number of new name options to you, and I'll cover those in just a moment. And from those, we're able to finally come down to, all right, this is a name that we think we'd like to move forward with. Let's make sure that it's legally free and clear. And we used a much higher legal standard, because we wanted to make sure that as we share these materials, we could invite you, encourage you, ask you to please share these as well. And we didn't want to give you anything where somebody might say, well, you know, somebody in Ohio has the same name and they're working in the same space. We wanted a name that was completely clear to you, so that we could give that to you and know that you'll be able to use it without any problems or any questions at all. And so we have achieved that, thankfully, happily, and we're very excited to be able to share that with you today. So if we can please go to the next slide, please. So these were the three initial names that we'd gone out to you with, and we asked you to let us know what you thought. And each of those images above the draft names are called mood boards, and it's kind of the look and feel. So not the exact images, but the things that would that could be conveyed as part of this campaign. So a place to call home, no place to call, no place like home, and then home for good. So we offered each of those for feedback, and you gave us a lot of really good feedback about it. You helped us to understand which names resonated with you, which ones didn't, what elements contributed to that resonating or not. And we took all of that feedback into account. And so this is kind of the good news, bad news part of the story. So we were able to get really great feedback on all three of these names. And then we went through legal review, and not a single one of them cleared legal review. So presenting some challenges there. You go from 64 to 3 and 0 all of a sudden, because none of them passed legal review. And there are things like, well, could we say in Arizona? And we said, no, we want something that's clearly, absolutely, completely clear, without question. So this is where the good news comes in. We're able to take all of your great feedback and really honor that and say, all right, how can we achieve the spirit of the feedback that was given and create a new name and be able to move forward. So if we can please move over to the next slide. So all of your input, what is a campaign? What does that evoke? People really liked having campaign names that had multiple meanings, that really made you think and kind of consider it from different perspectives. In a similar way, we're wanting them really to do the same thing about affordable housing, because people might have one image of it in their heads, but we want them to see it from different perspectives from all around the table. And again, we wanted it to have that really warm, inclusive, positive feeling, because we want people to feel empowered and excited to be part of this campaign, not pressured or guilted into being part of this campaign. So we took all of that great feedback and we came up with a whole new option that we're very excited to share with you. Drum roll, please, if we can move to the next slide. Ta-da! And here it is. Home is where it all starts. So this still conveys that very positive image. It's warm, it's inclusive, it's also available legally. And the reason for that, it's because Home Matters to Arizona, our key partner in this, has had this phrase trademarked since 2014. And they use it kind of every once in a while, but it hasn't been a big part of their branding. And that's the beauty of it. So it still conveys all those positive images. It still very much is in line with the feedback that you had provided previously, and it's free and legally clear to use. So we're super excited about it. And again, we're not necessarily using any of these direct images for the campaign, but but the feelings that emanate from these images are the kinds of feelings that we want to emanate from the campaign itself. So if we can just sit with this just for a moment, kind of let it sink in. It's something that we were advised with by the consultants is that we won't necessarily love it right away, but once it sinks in and you kind of, test drive it a little bit, that's often where people kind of fall in love with the name. So if you can go to the next slide, please. So, and this is what Home is Where It All Starts achieves for us. So it gives us a lot of different options. So if you consider the phrase home is where, you can fill that in with a number of things, like home is where I belong. Home is where I feel safe. Home is where I can be with the people that I love, for example. So it gives you a lot of different opportunities to really kind of flesh out, well, what's starting? My life is starting, my stability is starting, maybe my career is starting, my education. So it brings to mind all of these different really positive things that we can associate when people have affordable rents and mortgages. And so it really conveys that idea that it's not so much about it's about the housing, but it's about home. It's about being able to be at home. And it really helps to convey that. And it really goes beyond that physical structure, that building, into what does home feel like and what does home mean to us. And so we're able to weave all of those different elements into the storyline then as we launch with this campaign. We can go to the next slide, please. So this is one example of how we might use this in our messaging. We are in the process right now of building a landing page for the website. We're building toolkits, and Kelly Taft in just a moment will take over the presentation and walk through all of those different elements with you as she walks through the logo with you, through that visual identity. Any questions now before we turn it over to Kelly Taft? All right, Kelly Taft, the floor is yours.
Thank you, Amy. That was just a fantastic setup, because a lot of these same ideas and themes and have flowed through into the visual identity. So you can change the slide, Jeremy. So visual identity includes things like the font, the logo, the color palette, and other visual elements. So you can change the slide. So this is just a reminder of some of the advice Evelina had given us. That's the consultant working with us on this project when we presented the naming options. And they're also true for the visual identity. Again, don't expect to fall in love instantly, spend some time letting it kind of sit and resonate. So I'm not going to read through the following questions, but as you process that, just realize that what our target audiences know and believe about the campaign will be created not just through the name and logo, although they're extremely important, but also just through how those are used and how the campaign messaging occurs and the messages that we provide. So as you're processing this slide, I just want to tell you a little bit more about some of the direction that we landed on in terms of sharing our direction and when we were developing the logo as a team. So the working group wanted a logo that demonstrated depth and nuance that was reflective of the campaign messaging. And because of that, they had decided early on, we don't want some kind of an abstract logo. We want something that is just more definitive. They wanted to make sure that the logo conveyed positivity without being overly optimistic. We know that the subject matter is serious and we wanted to reflect that. It was also important that we include elements that feel like Arizona, that kind of pull into that, you know, this is our home and home is where it all starts. So it all starts here in the home that we live, both in our state, in our community, and in our specific locations. So you can go ahead and change the slide. And so without further ado, here is the mark. And when you take a close look at this, I want to just tell you a little bit more about the elements in the design. The icon on the left-hand side is intended to give the effect of peering through a keyhole. Some have seen it as looking out, some have seen it as looking in. But the keyhole motif has really rich meaning. It's the entrance, it's the start. It unlocks the new beginning. And of course, it relates to the concept of home and the literal physical structure of a house or an apartment. The icon is made up mostly of contoured and curved lines that feel organic. It seems more comfortable and approachable than something that would have straight or sharp lines. The interior of the keyhole is meant to evoke a quintessential Arizona scene, highlighting again our shared home. This reflects our key messaging about being in this all together, that we all have a stake in addressing housing affordability. The colors are bright and joyful with a mostly warm palette that leans heavily into the gold, orange, and brown tones. The sky has gradient shades of blue, and the overall effect is one of a stained glass window, which wasn't originally what they were going for, but a lot of us saw that. And we believe that stained glass often evokes feelings of hope and wonder and associated with our childhood and our home and our experiences. The word mark, which is the lettering, is a simple rounded sans serif font. It's welcoming, but not playful, excuse me, in order to retain credibility and respect the weight of this issue. All words in the logo except home are intentionally using lowercase letters to increase readability and accessibility. If you are looking at this on a smaller screen, I just want to point out the little symbol after starts is not a period. It's actually the trademark logo because, again, this is trademarked for us. So if you want to go ahead and change slides, Jeremy. So here's the mark without the name. And so it's on its own. You can take a closer look at the elements, which we do anticipate that at some points in time, this mark may be used on its own. So we hope that it starts to become really recognizable and it can be used for things like bullet points and infographics, etc. You can change the slide. So here is the color palette, again, leaning to those very warm tones to reflect the Arizona feel for the palette, orange, gold, browns. You can really see how that creates a sense of warmth. But it's also complemented by the gradient shades of blue, which also can be restful and also provide a lot of different kind of variety for things that we can do with this logo. So this is actually the same color blue. It's just in different shades of the same color, going from lighter to darker. So that spectrum can be used in different ways. And being able to have a spectrum of color helps us reflect the concept of movement and change that we know is going to be central to our campaign goals. You can change the slide. Here is a one color logo on a solid background. So if you're trying to print and don't have a lot of money to do 4 color logos, it could be done something like this. So it shows the various options we have with the color palette. And then the elements of the logo, the interior scene, you can still see are distinct and recognizable. So the next slide, Jeremy. So here's a full color logo and how it could look on different colored backgrounds in the overall palette. These applications could appear in things like collateral pieces or on the website. So it can just help to see, how it looks under different types of options, depending on what your agency wants to do. So there is a lot of variety that we can have, and it just provides us with a lot of different types of options. You can change the slide. So here's how the different blue tones could be used to provide visual interest and variety without being too busy. It's something that could appear again on a website or a collateral piece. I think here you can kind of get a sense of the depth, warmth, and movement that we're seeking to evoke in the brand. You can change the slide. So this would be like it in the wild. This is just a hypothetical billboard, but gives you a sense of how it might look in real life. And then if you could change, then here's on a t-shirt. Very bright, again, I think it's just draws your eye. I think it makes it evokes interest right from the start. It's just, I think, a very, very artistic and great way, and again, gets some discussion around the topic. And you can change the slide again. So we'll talk about next steps. So based on the public input session that we just had, and I don't know how many of you participated in it, but I think we had about 80 people online. So we did get some really great feedback. Javelina put out a Google poll after that just to get some additional. So we're processing some of that input. So there could be some slight modifications to the logo, but probably not substantive. So we will continue just to tweak that and make sure that, that we've addressed any concerns that were raised. You can go to the next slide. So on March 1st, the members of our team are going to be making, we'll be actually introducing the campaign. So this is kind of the first time it will be shared in public. We have scheduled a 70-minute session at the Arizona Housing Coalition Conference, which has been a great stakeholder for us. We're also going to be taking advantage of an art space opportunity where an artist is going to be on hand to sketch and interpret responses in that art space when people answer the question, what does home mean to you? So we think that's just going to be fun and engaging and a really great way to get some discussion. We can share some of the feedback that we received there on social media. We'll have a Survey Monkey where people can join our newsletter and things like that. So this is kind of the first sort of rollout that we're going to have. So we're really looking forward to that. We are also very excited, thanks to Dave Brown and Valley Leadership. They were able to help us get a foot in the door with Cox for an integrated partnership that's piggybacking on something that Valley Leadership is doing. So Cox is actually going to be assisting us and providing some great deals on doing this. They are going to be creating the actual website. So they're already starting to work on the landing page. So we'll be able to put those into some materials. They'll be working on production and media elements. We really intend to have a number of success stories on the site that feature individuals who've experienced a positive housing transition, and they're going to help us pull some of those video stories together and put them into video. And then they will also augment all of this work that they're doing with us by promoting and carrying kind of the campaign messaging on a number of their table elements. And so we get a lot of advertising through Cox. We've reserved a portion of the money back, though, to do some additional media buying and some other broadcasts and other types of outlets. So we are going to continue to fundraise to augment the media buys and some of the other elements we might need for the campaign. And then the last thing is we do have a toolkit that is in the very, very final stages, just waiting for a couple more assets to come in. And so we should have that within the next couple of weeks. And so that's one of the first pieces that we hope to be sharing with you. And then we will be reaching out and asking you to go ahead and use the toolkit. So it will have things like draft social media posts and the logo and graphics that you can download and use on your materials as you see fit. So we are really, really excited about all the work that's taking place. And so I think you can change, Jeremy. I think Amy and I are both available to answer any specific questions that you might have.
Thank you very much, Kelly and Amy. Are there any questions from the committee? I'm unable to see the participants. So if there is anyone, please feel free to unmute yourself and speak up. Okay, it sounds like there aren't any questions. I'll share that I had been along for the ride for some of this as well, and I'm happy with where you landed. I think you did some really great work here. So thank you very much. For me, the logo evokes a lighthouse a little bit, which resonates with the whole wayfinding for stability. So I don't know that that was intended, but it's an added bonus for me. And so last call for any comments. Otherwise, thank you very much.
I think
go-
Melanie has her hand up, Madam Chair.
Oh,
I
great.
was just gonna contribute as well. I've been along on a couple different groups that this has gone through, and I know they actually say the image is really representative of a keyhole, which I didn't get at first either, but I actually like your lighthouse one as well. So I think that's what's kind of neat about it in general, is that it can represent different things. And I had mentioned at one of the last meetings I was on, I actually like this slogan better than all of the three before. So to me, it really does. And I think the only other thing I had mentioned is when we do put things out, trying to use the word home more so than even homes or other things, because sometimes things will generate the thought of a single family residence versus multifamily. And so I like trying to stick to just the word home, because I think that helps people envision again what they say. But I love the upcoming thought of the art piece of it. So I'm excited to see what comes out of that. So I hope that can get back to us at some point. So thank you.
Great.
Thank you. Madam Chair and members of the committee, if you have questions at any point, please do let us know. But really, we would love to hear from you, particularly around if you're able to link to this from your website, if you're able to share these materials through social media, through your distribution lists and your newsletters, anything like that would be fantastic. So we'll keep you apprised of when the final products are ready. We are making some slight modifications to the logo, and we'll be happy to share that with you. But when we share it with you, please, if you could help us to get the word out, that would be fantastic. And we are very thankful to the communities that have contributed so far to the regional media buys. That includes we have the City of Avondale, Town of Paradise Valley, Virginia G. Piper Charitable Trust, and I think it's Fountain Hills as well. So thank you very much for assisting. And if anyone else would like to, then that helps us to further our reach. But that partnership with Cox will really help us to really fully leverage those funds in a really great way. So thanks to Cox Partnerships and to Javelina and to Home Matters to Arizona as well. And thanks to all of you for partnering with us and being on this journey with us. We understand that's a lot of time. Thank you.
Thank you, Amy. Our next item is a presentation on the homelessness assets and needs data for unified planning, known as Hand Up. Maggie Wong, a research analyst with MAG, will present on this item. Maggie?
Thanks, Madam Chair. Are you able to see my screen, everybody? Awesome. Good afternoon. My name is Maggie Wong. I'm a research analyst here at MAG on the Regional Analytics Division. We partnered with the Human Services team and then community partners, including Solari, to develop this interactive mapping tool a few years back. And the purpose of this was really to visualize the wide variety of services that target people experiencing homelessness throughout the region. So right here, what I have is the home screen when you first go to the website. So the website is geo.azmag.gov/maps/handup. And it'll bring you to this login screen because this actually is not a public facing tool just yet. It is meant as a planning tool rather than as like a Google Maps situation. So we do have a password. And if you are in need of the password, there's a button right here at the bottom right of the page that says request access. If you click that, it'll pull up a form where you can put in your organization, title, name and email, and then our team will get back to you with a password for access. And the purpose of this really is because this isn't meant for clients who are searching for services themselves. The process for, entering the housing search or entering a shelter is much more different than just showing up at a physical location. So again, I just want to emphasize this is meant as a planning tool. So I'm going to go ahead and enter the password to put us in. And so hand up stands for homelessness, assets, and needs data for unified planning. This map really was developed out of the idea of a needs assessment for the region. So as you can see here on the map, there's a ton of different icons, and there's a legend right here on the right, which shows what each icon stands for. So there's all these different categories, including coordinated entry, shelters, housing, food, and more other services that can be accessed by people experiencing homelessness. And you are also able to download a glossary, which would explain these different categories more. But you can see that you can really toggle on and off these different points. And then if you click on this little plus button here, you'd be able to see all the subcategories within it. So say we only wanted to look at emergency shelters. What I could do is I could just toggle off everything else and just look at emergency shelters across the region. Now, the source for all this data comes from Solari's Arizona 211 service directory. What we did is that we partnered with them to get an export of all the services that we thought would be useful within the homeless services realm. So you're not going to see every single service on here, but we really tried to include services that would be useful to the population. And just it gives you a sense for the type of access that people might have in different regions and locations. If you click on a specific point, so let me just click on one of these here. Give it a second to load, but a pop-up will pull up, which gives you additional information on that specific location. So you can see here that this one is a rapid rehousing program. And so it'll show you the service provider name, the address, the housing type that they provide. And then if it's coming from our housing inventory count, then it will also include the total number of units and beds for the program. So we use AZ211 data, but then we supplement it with our Maricopa County housing inventory count, which is done annually. And what that does is that it lists out every single program related to emergency shelters, transitional housing, rapid rehousing programs, permanent supportive housing, and then any other permanent housing programs. So for data points coming in from that source, we would have the bed and unit count. But otherwise, so this is a program that came in through the 211 data. You'll see it's a little different. This will include hours, a description of the service, eligibility, intake process, and a website link. So it really just depends on the data source that's being used to pull in these programs. And you can even click this button to kind of zoom to that area to see exactly what's there. And what you might have noticed too, I clicked on a point, and sometimes there's multiple programs at one location or in a similar location. So you would just click the arrows to see all the other ones that are there. So in addition to showing the locations of all these different services, we also have various map layers, which kind of work as an overlay in the background. So these are data layers that you can add to the map. So this first section here is maps that use census data. So for example, if I click on total population, you can see the background changes, and now it's showing total population by block group from the 2020 ACS, that's the American Community Survey, 5-year estimates. So this could give you some more information on the population concentration in an area compared to where these services are located. We have a couple other topics here, including percent of population 62 years and over, if you want to look at the older adults population, percent below poverty level, and then also median household income. So when you click on any of these, the background map would toggle to that. And if you hover over this little information icon, it would give you some more information about the data source. So that's the census map section. We also included some background maps related to homelessness specifically. So this one is Street Outreach 2021 locations. It shows where street outreach workers encountered clients in the year of 2021 by census block group. So the areas with the darker blue are areas where there were more people encountered on the streets. We also include locations from the unsheltered point in time count from 2022. So this is where volunteers encountered and or interviewed people who said that they slept on the streets the night before. So just a couple different data sources to provide some more context for homelessness across the region. This is a pretty interesting data point. So this one is last self-reported permanent address by zip code. And this is something that we get from the Homeless Management Information System, or HMIS. That's our region's homelessness database. So this is a field that is required for clients who enter the system. They'll tell an outreach worker or a service worker where their last permanent address was. And we do want to emphasize that this data is self-reported. So it could be that they misremember or maybe they don't even know, but based on what we are given from their self-reported answers, we did map it by zip code. So you can see in the darker orange are zip codes where more people experiencing homelessness reported their last permanent address to be. Quite a mouthful. All right, and then this last one here in this section is showing 211 calls requesting homeless services. So these are calls that are related to things like rental assistance, rent payment, rent deposit, or anything related to eviction or foreclosures. And the data being shown here is for the first half of 2022. That's the last time we received the data from 211. And so once again, this is just showing in the background by zip code where these calls were coming in from. This next section of background maps is the at-risk population maps. So these are things that could be factors to homelessness or just could be good context to know for a region. So in addition to the calls for homeless services, we also received 211 call data for rental assistance and utility assistance. And again, this is for the same time period of January through June of 2022. We are looking to update this data sometime this year, whenever we're able to get our next export from 211. We also have evictions by block group, which is able to be selected as a background layer. So this will show you the block groups where there were more concentration of eviction filings. We have it for 2020, for 2021, and then for the first half of 2022. So those are all the different background map layers you can add just to make this more of an analysis and planning tool. Whenever you select a background map layer, you can clear it by clicking this button right here that says Clear Map Selection. In addition to those background data layers, we also have some additional layers that bring in more points on the map. So one that I want to show specifically is community action agencies. So we have the locations of those, and it might be hard to see just because there's so many icons on here. So what I'm going to do right now is I'm going to just toggle all of them off, and you can see right there in that little gray icon with a hand, these are the locations of all the different community action agency offices. We also are able to show housing authorities as well. We have the addresses for those offices as well. So you can see that it's a little hard to see when you have so many on here, but you know, based on how you're using this, you can toggle the legend to show what you want it to show. So that's everything I have in terms of the data. A couple more things I want to highlight about this tool is that we do have a little feedback form if you have any comments or questions you want to add, and this will just send an email to our team so that we can get back to you. You can also print the map or your view of the map if you wanted to use it for presentations or just to print out and look at on your own. And then we also have this about section, which just brings up more information on how we developed the tool, the different data sources behind it, and our partnership with Solari and 211. If you click on this help button, what it does is that it brings you to a little tutorial of the map, just in case you forgot any of the different functions. And I think that's about it. Hopefully I didn't go too quickly, but if you ever have any questions, you're welcome to reach out to Kelly or her team or directly to me. My email is mwong@azmag.gov. And that pretty much wraps up my demo. I'm happy to take any questions you might have.
Awesome presentation as always, Maggie. Thank you very much.
Thank you.
Are there any questions from the committee? Please feel free to unmute, ask, since I can't see hands raised.
Okay, I'm going to, it's Melanie with Tony Gilbert. I think I missed it. I know I've seen this once before, Maggie, but I know you said it's a planning tool. Is it accessible right now to us to look at the different data factors?
Oh, yes. It's a planning. And what I mean by planning tool is that it's really not meant to go directly to clients, but anyone with our municipal government agencies or community agencies, nonprofits, we are happy to share the password. We just ask that you request access through the website to get the password. But yes, this is available for any of you to use.
Can you clarify for me again how to access the website to do it?
Yeah, no problem. Sorry, I should have included a link or something. So the link is geo.azmag.gov.
Maggie, we'll send all that out.
Yeah, I'm like, can you do that?
Thank you. I'll just show you real quick though. So basically when you go to the website first, it'll bring you to this page and the pop-up is just reminding you this is not a public facing tool and it's really just meant for planning. So you click acknowledge and right down here on the bottom right, there's a request access button. So when you click that, you'll just enter in your information and then our team will get back to you pretty quickly with the password. Yes. One other thing I realized I forgot to mention is that currently this data that is being shown it was updated as of May of last year. And that's because the import and export process takes so long. We are looking to update it again this year. So maybe when we do that, we can send out an announcement. But just so you know, we usually update it once or twice a year, just depending on the timing and then the merging process of all the different data sources.
And does that say that on there somewhere that data is relevant only till May?
Let's see. It does not, but I will mention that to our team. We should add that on there in the legend.
Only because especially since we just finished the pick count and if people think it's an update from, some of that, especially the outreach piece, I would definitely make sure that it identifies what dates is relevant.
Absolutely. Thanks for bringing that up. And then the other thing is that for all these other data sources that we bring in, we do include the dates that it's for. Like here you can see like the HMIS data is only for the first half of last year. And but yeah, we'll make sure to get that on there too, a kind of like last updated data date. Thank you.
And Madam Vice Chair, that's it. To emphasize Maggie's point at the beginning of her presentation, that's also why it's important that this not be a public tool, because the last thing we would want to do is have folks, again, going to certain locations looking for services when there is a gap in how quickly this can be updated. And Madam Chair, I see that Karen does have her hand raised.
Oh, great. Karen. Karen?
Sorry, I thought I hit it. It just didn't hit.
Of course.
So this is my first time being exposed to this data tool, so I really do appreciate the presentation. And for those of us who are developing various reports, HUD reports, annual action plans for the federal funds, I think this would be a wonderful asset to put in our toolkit, so to speak, and add additional current data. So going back to the prior question, as far as the frequency of this data being updated, is there any way that MAG could consider the timing of some of those reports so we have the most current and available information?
Great question.
That is a great question. It's something our team has talked about a lot just because the effort that goes into here it's a lot. As you can see, it's bringing in 900 different services and programs. And because there's two data sources, there's a lot of need to deduplicate and determine which ones to keep or get rid of. So right now we've committed to updating it twice a year. And we are trying to time that to be around the time after we've finalized HIC count numbers, so we can include that as a layer, and also to have the most updated HIC data, the housing inventory count data. So that would be, I want to say, around May or the summertime, and then a second update later in the year. So that's what we are aiming for this year. If you have any other feedback, please feel free to reach out to me or Kelly's team, and we can definitely discuss it. But yeah, I hope that answers your question. I know it's really hard because you want to have the most up-to-date data. It's just that these are such huge amount of records that we're really hoping to use it as a snapshot for a point of time in year, right? For what services are available.
Yep. And I understand that. And as long as we have the parameters and they're prominently shown, if we did,
Absolutely.
Did a snippet of this and included it in our report, at least then there's full disclosure of the timing. So one of the communities here in the Valley isn't reporting something different than another community as well, and creating more confusion.
Absolutely. Yes. So we will, I will speak with my team and we'll get that updated as soon as possible. Yeah, exactly like you said, just so when you're referencing it, you know exactly what to reference it as. Yeah.
Maggie, will you please stop sharing your screen so we can see all the members?
Oh, yes.
Thank you. Madam Chair, I see that Susan has her hand up also.
Oh, great. Susan. Don't forget to unmute.
Sorry about that. I had another screen up on my screen and I couldn't get
I hate
out.
that.
So thank you, Chair. Thank you, Maggie. I've had the pleasure of working with Maggie before and seeing her brilliant work. It's amazing to see all of this displayed. It gives me a great deal of hope for the state of homelessness in Arizona and in the Valley, Phoenix Valley for sure. I was really excited to see a number of the specialty services highlighted, like the pets, the legal, the hygiene. Those are really important, services that I think sometimes people, they miss. They think it's all about the housing and the food. So I was really appreciative. My quick question about all of that is, there's a lot of resources that are identified on there. How sure are we that each and every one of those resources is an actual resource for homelessness versus a standard, pet service or standard clothing service, that type of thing?
That's a great question. It's one that we talked about a lot while developing our methodology for selecting. What we did is that our human services team sat down with the AZ211 team to really try and drill down. I will say it's not going to be perfect. Like, there will be services on there that may not be homelessness specific, but we did our best to grab as many services as possible, like you said, so that it's a broader range rather than just the standard food, shelter programs. So we're really hopeful that we covered it. But if there are any issues or if you have any comments or suggestions, definitely send them our way. We want to be as accurate as possible. So what I'll say is that we might have included a little more, but it was in the spirit of showing, all the different services that are available. So yeah, through our discussions, I would say we're fairly confident, but there are definitely, because there were so many programs, we couldn't look at it by record basis. So we had to look at the major categories and then apply filters to like eligibility and stuff like that. So there are things that might have slipped our eyes while going through that, but we did our best in that way.
And then my last question is, does this technology lend itself to maybe being available for other social conditions in the future? For example, substance abuse, domestic violence, low income, the ability to take a tool like this and, highlight a different social condition. Not that, in most of our circumstances are the individuals and families we're working with are kind of multifaceted. But in some situations, they truly have something unique, and it might be, in the substance abuse arena versus, homelessness. And I just think that the possibilities, the potential for this kind of technology is amazing.
Thank you. And yes, absolutely. this is a really interesting project for our team to work on because we just think it can be so helpful, and it's just a different way to visualize it all together on a map that's not just Google Maps and is not just a paper directory. So if we have the right data partners, if we have the right team, it's absolutely possible to transition this to another focus. It just so happens that our first one is focused around homelessness in the region. So yeah.
Thank you. Well, great questions from our committee and great work from you and your team, Maggie. Thank you very much.
Thank you
Look
so
forward
much.
to the next time we hear what magic you've worked. Thanks.
Thank you.
Our next item is a presentation from Jana Scott, Director of Systems Change Initiatives. She's going to present on the YWCA's new Systems Change Initiative and building healthy, resilient communities. Jana.
I actually wanted to ask my CEO to frame this presentation, and just wanted to be sure that everybody knew Debbie Esparza, and she's going to take some time to really bring us into this, and then I'll come back.
Sounds good. Thank you.
Thank you all. And boy, were those great presentations. Well done. Congratulations. Incredible work being done. I'm Debbie Esparza. And again, go ahead and change to the next slide, please. And I am joined, as you already know, by my esteemed colleague, Jana Scott. And Jana was the perfect person for me to reach out to when we applied for this grant. This grant is moving us to another level of work. So my part of this program, or our presentation today, is to tell you a little bit about YWCA and why we were called to this work. And then Jana will tell you more about how this work actually applies to many of your communities. So next slide, please. YWCA has this incredible mission of eliminating racism and empowering women, and promoting peace, justice, freedom, and dignity for all. That's a piece of cake, walk in the park. We should be done, in a couple of weeks. The reality is, and many of you may not know this, we have been in the Phoenix area, in the county area, for 110 years. Our national organization has been in existence for 160 years. We've been, regretfully, one of the best kept secrets. So again, that's partly why I want to share with you some of the bigger picture of who YWCA is. We work on 3 levels. We work on the direct service level, and that's where our friends at Area Agency come in. I'll tell you a little bit about our older adult and senior programs. Those are direct services to help communities and to fill the needs that we've seen on that map, right, in various areas. The next level we work in as an organization is in learning. Some people call it training, but learning is something that we have to really build for ourselves and not just give to people, right? So a learning area. And then the next one really about advocacy and change, and advocacy as it connects to those elements of a healthy community. And I'll talk about those in a second. But the other direct services that we provide at Metro Phoenix are equity programs. We have a program, we're rebranding it, calling it Until Justice Just Is. We'll have a summit. We'll have a challenge for learning that individuals can participate in. And this year, that's going to be housing. So the conversations you were having were important. Disability, mental health, and music, even on how music and impacts and our lens of music and those other subjects. When you put the lens of race and gender on it, you come up with different conclusions and you see different information. That's equity programs. We do organizational equity programs for small nonprofits in town that we're piloting right now. We also have prosperity programs, which are being built out further now. They have been historically financial coaching and financial education, but we're expanding it to really take a more holistic view of prosperity and how that impacts women and people of color. And then, of course, our longest standing program is our meals service that we do, like I said, in partnership with Area Agency on Aging. And we serve about 100,000 meals a year now. It was about 120 during COVID, so it's come back down a little bit. Not only do we do home delivered meals, we do congregate meals, the wellness calls, and now we have another concept called More Than a Meal, where we actually partner with other organizations like CAS to do some preventative work to identify, are our seniors that are getting our lunches every day, are they at risk of being homeless or having a housing situation that we want to raise up before it gets too late. So that was an innovative partnership between YWCA and CAS, really focusing on that very vulnerable older adult population. Next slide, please. We do all of this, again, with this view of what's happening in the community. And as you've already identified, and I know you all know very, very well, all of these things are integrated, they're connected. And so somebody that needs lunch or a meal probably also needs something else. And so we look at these elements of a healthy community and really look at them through this lens of race and gender. And what happens more, as we all know too, after COVID, women and people of color were impacted more dramatically than non-women and non-people of color during COVID. Especially if I had two jobs, especially if I had to deal with educating my child with no Wi-Fi access, especially if I didn't have sick time, all of those things, or I had a multi-generational household, all of those things were exacerbated for women and people of color during that period. And it's going to take longer for those folks to come out of the challenges that we've all faced during COVID. So the work that Jana is going to introduce you to takes a real focus, next slide, please, takes a real focus on how do we change that? What needs to happen in the system so that there are not as many older adults that need meals, or that there are not as many folks that can't get access to healthcare or housing or financial services, or fill in the blank. What do we need to help change in the system, which is different than how do we just provide more direct services? We're really good at providing the direct services, but we're also, this lets us move to that top layer of how do we create the change so that it's more equitable, more accessible, and really is listening to what the needs are in the community. So let me turn it over to Jana. Jana has a long background in public health and systems and policies. And so she was the perfect partner for me to reach out to. And I'm so thrilled that she came onto the YWCA team to help lead this systems change initiative. Jana.
Well, thank you, Debbie. And thanks to Kelly and Amy, who I originally spoke with about this work, and who they really caught the idea of how important it is for us to pay attention to certain populations and their health and mental health post-COVID. Next slide, please. And so this grant that we received from Maricopa County really rolled right into that issue. How do we bring, number one, a race and equity lens to the problems affecting people post-COVID? Our target populations are seniors and LGBTQ young people between the ages of 18 and 24. And our target geography is the Northwest Valley. And so I know none of our towns who we're focusing on are here today, but we've been in contact with many of them. And you can see who's involved: Aguila, El Mirage, Glendale, Peoria, Sun Cities, Surprise, Whitman, Wickenburg, and Youngtown. I was actually really interested in meeting Mr. Dyson from Surprise. So Kelly, you'll have to let him know that he was missed at this meeting. But all of you are probably dealing with this similar issue. It's just that our focus for this year is on the Northwest. Next slide, please. And what we really are seeking to do, and we've begun to do really over the last 6 months, is we built a container of key thought partners, from universities to mental health providers to, because we are focusing on post-COVID mental health, to educators, to people with lived experience and their family members. So through this container, we've been able to leverage partnerships to really hear from people. What are the major issues that people are seeing now post-COVID? The county did their needs assessment, and they found that there are huge issues in racial and gender discrimination around the provision of mental health services. There were also huge issues around the rate of suicidal ideation, attempts, and even successful suicides. I don't know if I can use those two words together for young LGBTQ people. So we really wanted to hone in and say, how can we act as a convener and thought partner to help highlight any kind of barriers and opportunities to make change to systems, to policies, to the environment. And as we're doing this, we're collaborating with our community partners because we want to amplify what works. We want to amplify the voices of those impacted, and we want to show what doesn't work so that we can possibly make changes to that together. Next step. And so we really are asking our partners to act with us on this effort, this movement of systems change. And there's so much more to it, but in the time I was given, I wanted to just highlight in on a few things that we're asking our partners to do. One is to, next slide, please. One is to think about mental health as a core aspect of overall public health and well-being. Oftentimes we've siloed mental health into its own little place and used a lot of clinical approaches, but not really looked at how the intersection of economy and of the justice system and of education and all housing and all these other elements really do impact a person's mental health, and acknowledge that the impact on people of color, and we could even say people of the LGBTQ community, that the isms that they face in accessing services really is a public health crisis right now. So I would say, let's sit on that for a moment. Can we acknowledge that racism, genderism, and its impact on mental health is a public health crisis? We'll be at AZPHA for a portion of the day 2 weeks from now. And they've agreed to begin to have those conversations. Can we in the broader community understand that our economic policies, our housing policies, our policies around education, and the way they impact people of color and people from the LGBTQ community really does represent a public health crisis because of the way it impacts mental health. So we want our cities and our friends from your community to be part of the dialogue about potential policy and environmental and systems changes that can be achieved in this post-COVID. It's sort of an endemic environment now, even though we know all the vaccine mandates and things are being lifted. There are still people dying from COVID. There's still people dying from or suffering from long COVID and the impacts on their mental health associated with that. So we want you to be part of the dialogue and helping us figure out where can we change policy systems and the environment to improve the well-being of people in our communities. And then thirdly, we'd ask you to help us increase awareness about post-COVID race and gender disparities for seniors of color and LGBTQ young people in accessing mental health services. The reason we want to increase the awareness is because although COVID, a lot of people might say that's over, the fact is the disparities remain. And when we think about the disparities of a homebound senior who's a person of color, who might also have an intersection with LGBT, and how they are suffering in silence, we know that certain programs that are reaching them, we're going to begin to try to make sure that we can bring some hope and joy. One of the things that Debbie didn't mention was our Bundles of Joy effort that we do with our seniors, where our home delivered meal program includes bringing some light in terms of a beautiful message that's been written by somebody in the community to our seniors as a way to give them a little bit of light, give them a chance to experience laughter and belonging. I mean, that's at the very beginning levels of mental illness. But then at the deeper levels of SMI, how do we support those families who are dealing with serving and caring for a family member with SMI, and it may be affecting their sleep, their job, other people in the family. So there's a lot that we want to get answers to. Our next phase of this is actually doing these listening sessions in community. I talked about our thought partner sessions, but now we're going out to communities around the Northwest Valley. And we're going to be using some of the similar things that Amy talked about, in infusing artistic expression into these opportunities for people to have an opportunity to tell their story, and then to capture those stories in a way that speaks to policy, speaks to systems, speaks to the environment. And I'm grateful to the county for giving us this opportunity. They are listening. They're wanting to know, who are we not reaching? How can we do better? And they want us to really move out into these cities and towns where a lot of unreached people are. So we ask those of you in your cities, I know there's colleagues all across the valley here, but to help us think through this, if you can. If you want to contact us, and I'm going to turn it to Debbie for the contact info on the next slide. But please do know that we're not doing this in a vacuum. We want to do it in concert with our partners. Debbie?
Just about to talk before I turned off mute. Thank you, Jana. And again, this is such important work for us. And go back to the other one, please. As a part of this, we've got a report that takes us up till now that you see there. Let's Talk Justice and Mental Health. That's available for you if you just contact us, and we'll be happy to send you an electronic version. Every quarter, we also talk about our highlights and what's happening. That's a combination of inputs, outputs, and impact in all those direct services that I talked about. The one that I forgot to have us put on here that would also perhaps be of interest to this audience is a report that we do in partnership with our national organization, and it comes out annually, and it's Why Women Vote. And we have another deep sampling of why women vote in Arizona, and they talk about the key issues that they're facing, women and people of color, and they're often safety, access to health care, child care, and it talks about those issues from their voice. So I apologize, I didn't put this one on the slide, but if you contact us and you want any of this information, including Why Women Vote, we'll be happy to send that to you. Next slide, please. And then you can do the QR code. This is magic in my mind. I have no idea how the little gremlins make this happen, but you can sign up for our emails and or email to me or Jana to get you the reports. Our website is there. All of our handles are there. But please do stay in touch with us and let us know how we can, lift up what's happening in your towns and cities, as well as how we can support. So thank you very much for allowing us to be here today. A big thank you to Jana for spearheading this initiative and this whole new way of work for us. I'm so very grateful and honored to be here today. So thank you.
Wonderful. Thank you, Debbie and Jana. That was a great presentation and exciting work that you are doing. I know as far as the city of Goodyear is concerned, we completed phase 1 of our neighborhood services master plan last year, which focused on human services and system change. Would love for you to take a look at it and welcome any feedback and opportunities. You see the last pages show the areas that we hope to focus on over the course of the next 5 years. And if you see an opportunity to collaborate, would welcome that. And we're almost done with the neighborhoods phase, which talks about individual leadership and connecting residents. And I think there might be some opportunities there. I'm sure other people on the committee might have something to share or opportunities to connect. Any comments, questions?
I wanted to just mention one thing about Surprise, who I had hoped would be here, and their needs assessment. I'm sure they're updating it now. But even when we looked at the needs assessment that was on the MAG website, they were seeing as many as 28 calls a day that had a mental health nexus in that town. That's not a big population. So think about that. That was pre-COVID. And we know that the mental health of our communities have been hugely affected in COVID and post-COVID, whether it's the grief, whether it's the loss of job, whether it's, as Debbie mentioned, being concerned about being a multi-generational household and working as an essential worker and bringing home God knows what. And these are folks who are carrying all this, and it's affecting our community lives. And so we've got to get to the ground truth about this in every city in this valley so that our communities can be healthy and grow. If you think about some of the strange things we're seeing across the valley now, it kind of makes you wonder, what are people holding that they need relief from?
Mm-hmm.
And so I just really encourage all of you to think about that. And I want to thank Madam Chair for mentioning about their assessment. I will be reaching out through Kelly to get a copy of that.
Oh, I'd love
from you.
that. We centered on social determinants of health also. So I think you'll see alignment. I see Kristen has her hand up.
Thank you. Such valuable information. Could not agree more. And as such, just wanted to, it seems like self-promotion, but in Tempe, we, well, I just want to echo what Jana's saying, is that in Tempe, you know, we were working around the edges of mental health. We've been at Care 7 addressing the mental health of the people we serve, victims of crime, students in our schools, all the things. And so we have a trauma education program here where we really, our goal is to help people understand what trauma, specifically childhood trauma, how it affects your potential over the rest of your life, which is, you know, on average going to end 20 years earlier because of your trauma. So, you know, we take it really seriously, but COVID and its little silver lining of highlighting human suffering, leveling the playing field, and highlighting the need for more human services. Really, we kind of responded to that in a way, I don't know, all the stars aligned, the planets aligned, and we had a police chief who is sadly leaving to go to the state, but to DPS, but he decided that part of his reimagining of his police department was to not, to try and not have law enforcement respond to calls for mental health, you know, that's like out of their scope. And so all the things happened, and we decided at Care 7 to pursue becoming a behavioral health agency. So we are now a licensed behavioral health outpatient program.
Wow.
And I know, I don't even know how it happened. A lot of just hard work, luck, kind of a lot of the programming that we already had in place really kind of was leading us to this space. So as such, we will be part of Solari's crisis system. We will be able to bill Medicaid for this. I mean, I can't believe, sometimes when I say it, I get little like.
Yeah, that's phenomenal for a city to have done that.
Pardon?
For the city to have done that.
For the city,
it's phenomenal.
I believe we're the first municipal government agency to
wow.
enter into the system. So it hasn't been easy. We're still waiting on a couple of things to drop into place before that we can actually, you know, send out our first bill to the insurance company. But I think it's going to be, this is my very humble opinion, and check with me 6 months from now to see if any of this came to fruition. But I kind of feel like it's the wave of the future. I feel like there's so much work to be done. So many, our housing, we have a housing department, plus we have an affiliate. And so many of our participants, housing participants, need case management for a lot of different reasons. And there's a lot of different people think of, when they hear the phrase case management, they think of a lot of different things. I'm talking about care coordination, where we are really getting in there and saying, you need help with basic life skills or coping mechanisms, or, job finding, whatever it is. These are all billable now that we're a behavioral health program. And so I don't know what the future holds, but one thing I know for sure is that it holds reimbursement. And in this world of scarce resources, I'm equal parts. Well, no, it's not equal anymore. I used to feel as a public servant, I've been here at Care 7 for 25 years. So public service and doing this for the community because we should is one of the basic tenets of my life. I now see the value in getting reimbursement from payers for this. And so, lots of other community agencies are doing it, and they're able to really add a lot to their toolkit, if you will. And we were not able to do that yet. We're the ones with relationships with the housing department and our police officers and our firefighters. And so it just made sense. So I'll keep you up to date and let you know, but Jenna, nothing could be more true. We have got to understand the realities of especially our young people and their inability to cope with the very adult things that are happening to them. Our school administrators are equally ill-equipped to deal with what's happening on their campuses. Their campuses they've gone away from being purely academic institutions to being what I like to say, they're little cities now, and principals are city managers. They're dealing with crime, sexual assault, human trafficking, so many things. And the principals are like, help, and so it's really just like, you're right. Everything's changed kind of. And it's up to us to respond. So, or that's my editorial. It's up to us. So thank you for that. It makes me feel like all this craziness that I've been going through might have a purpose, and that there might be other people who believe that as well. So grateful for especially the equity conversation. That is something that we have been taking into account as we've been moving forward with all of our service provisions and development. Is what does that look like? And we have to get community feedback, and especially we are really working about social determinants of health. So I love hearing all the things. It makes me very not happy that we have to do it, but happy that we're willing to do it. So thank you for the opportunity.
Thank you. Madam Chair, I think Mary Lynn might have had her hand up earlier, if there's still time.
I saw that too. Please, Mary
Well,
Lynn.
And thanks to
quickly,
Kristen for that encouragement.
Yeah, it was a great presentation, and I really applaud the work that the YWCA is doing, especially on racism and empowering women, and the great work that Debbie and her staff do with older adults. One of the side effects of COVID was extreme isolation and loneliness among older adults. We actually, and I know almost all of our providers had telephone reassurance programs during COVID when senior centers were closed. We are also a licensed behavioral health agency, and so we serve the 60 plus. But one of the things that I think, Jana, is important too, when you're looking not only at racism, but also ageism. And so if you are a person of color, you're LGBTQ, and you're older, you got like a triple Rammy. So, you know, just I have to speak up for our population.
I appreciate that, Mary Lynn, because I check all those boxes. I identify lesbian, Latina, and a boomer. So it is getting more and more complicated. But thank you again for your partnership.
Thank you.
Great sharing. I'm excited by everything that everyone's doing. Thank you again.
I just want to, Madam Chair, if I may, just thank Kelly and Amy, who saw enough in this to bring us before this group. Just very grateful for your attention and your input and your comments. And Kelly, Amy, you guys rock. So thank you.
They do.
Well, it's our pleasure. Thank you very much, Jana and Debbie, for being here. And I will say, listening to your presentation, it made me think about other places that I'd like to plug you in. One of the areas that MAG is leading also is a race equity plan for our continuum of care and the provision of homeless services. And I think our continuum would also really benefit from hearing from you both. So thank you very much for being here.
Always the connector. Awesome. Thank you. So that's a great sharing too from Tempe. Thank you. And Mary Lynn. I think that's a good transition to this next section, which is about our vision for 2023. And I know Seth didn't get to join us, but Kathy is still with us. Not to put you on the spot, Kathy, but you missed how excited I was to have you on the committee. And we would love for you to take a couple minutes and share with the rest of the group a little bit about your background and kind of what you hope to get out of your participation in this group and how the rest of us can support you.
Thank you. My name is Kathy Chang. I'm the Assistant Director of Community Services for Maricopa County, and I will sit as Jacqueline's proxy. I'm just hoping to expand my knowledge of what your organization, this organization does, as I know that there's multiple ways we intersect in the continuum of care. One of those ways through community action is prevention, right? So we've done a lot of work in the space of eviction prevention. We're coming, as it's winding down, we're trying to prepare or soften the COVID cliff that's coming, where funding returns to pre-pandemic, unless there's some other intervention that happens by the feds or the state to say like, no, this housing is an important vital part of what community action should continue in. So I know that Maricopa County is in a number of spaces in the housing, in the homeless arena. And so I'm really like, I'm a newbie. So any knowledge you want to give me, go ahead and lay it on me. I did sign up for the one QR, it's a QR code, right?
Yeah.
So I put my information in there for the mental health, that one, and Let's Talk Justice. So I am interested, my team's starting to develop a holistic, transformative approach for when clients come in, whatever door or access point they come into the county. And we're trying to understand how can we make their experience easier. I love the logo work that you guys were doing. I loved how it looked inclusive. I thought, wow, that's amazing. It made me feel good. It made me feel all those things that you were thinking it should. So I don't know if that answers your question, or your direction, but that's what you got.
Well, that's awesome. Thank you, Kathy. It did. And we're really glad to have you on this group. The group originated with the purpose of making SSBG funding recommendations, but that was a requirement at the time and it checked a box, and that box isn't really necessary anymore. We still do that function as a group, but there are so many valuable members here that are doing such innovative and transformative work in the area of human and social services that I think to spend the rest of our meetings waiting for SSBG allocations is a missed opportunity. And I don't want to steal Kelly's thunder, but we did put out a little survey of the group to get your feedback about like what you hope to get out of the group. And I think that was reinforced, and Kelly's going to share some more, and then we'll come back and discuss kind of what we would like to see happen in the year ahead. Kelly, I hope I didn't overspeak.
Madam Chair, you certainly did not. Thank you. And I recognize we are 5 minutes over and we may lose quorum. So the bright side to that is that we're not voting on anything at this point. So, but anyway, I will keep this brief. I did try to check in with as many of you as possible in person and also through the survey regarding what you want to personally get out of this time. We recognize that your time is very valuable and we want to make sure that we're using it appropriately. The consistent theme that we heard over and over again is that you do not want to just be an SSBG funding decision machine, that you want your time to also be put to value. The other theme that we heard loud and clear is that you want to be able to prepare other officials that may be coming from your cities, from your organizations to our Human Services Community Initiatives Committee, which is the policy arm. You all are the technical arm, they're the policy arm. So how can we prepare you to be able to prepare your officials or your colleagues for that meeting, which happens next month? And we heard that, and I think it reframed our team's vision also, along with in the conversations we've had with Chair Penatescu as well. And so to give you an idea, what we have planned for the March Community Initiatives Committee includes the presentation from Amy and Kelly again. They really want to come in and talk about their work in affordable housing. We have Maggie also presenting again on the hand up tool, so you're aware of that. And we have a couple other presenters, nothing, and we'd be more than happy to share those with you, but we are really going to try to be very intentional that we have technical presenters at this meeting on the same topics that we're going to provide policy information on the next month at CIC. If you have any direction for our staff on what technical and policy you want us to focus on, we're all ears. We recognize that you may all be getting a little homeless fatigue. I know that in our office, we work on homelessness every day, and we're certainly feeling fatigue as far as trying to come at a huge problem and eat it one little tiny bite at a time. So again, our ears are open for any sort of human service issue that you would like us to bring presenters in to be able to discuss. We did talk about food insecurity and a couple other issues moving forward, but we really did want to focus right off the bat with both the hand up tool and the affordable housing information, in part because we've just come out of our point in time count. And we know that homelessness is really, it's in the news a lot. It is a growing social concern in our community, but we do not have to spend the next year talking about that. It's really up to you and what you'd like to hear. And with that, Madam Chair, I will hand it back to you.
Now I need to remember to unmute. Thank you. For the sake of time, I guess, is there anyone who disagrees with what was described by Kelly? Okay, good. There shouldn't be any surprises because of the survey. So also, I'm excited by the innovations that are happening in your work. Like, again, Kathy, not to just throw you out there, but you're really innovating over on the county side what you're doing. And I personally am kind of skipping ahead / smushing this agenda item together with request for future agenda items. But I know I would love if when you're ready for you to share with the group more, and also if this group can be a resource for you in being a sounding board, providing feedback to what you're thinking. And same thing with Tempe. After you get your legs under you in terms of being a behavioral health program, it'd be great to hear lessons learned, where the landmines are, things not to do, things that you are really glad that you did do. Is there anything else that anyone has to add, or do either of you object to the ideas?
Just not right away.
Yeah.
Like, I'm
Next
not gonna-
month? No.
Okay, no.
Fair.
Well, Madam Chair, I think this bleeds nicely into the final 2 points on the agenda, including meeting agenda ideas. And
Yes.
I don't want to put anyone on the spot, but I will just say, I just want to reinforce that our team is here for you always. I realize we only meet 6 times a year, but if there is something that comes up that you think would be important to discuss at this meeting, please feel free to call us at any time. Call me, send me an email, and we'd be more than happy to track down speakers on a topic of your interest, et cetera. And so, or, if there's conference information you want to share, if there's successes out of your areas that you want us to share, we are happy to communicate that to the committee at any time. It does not just have to be during these meetings.
Sounds good. I will share that the City of Goodyear is about to release a mental health RFP for pilot programs for services to be delivered in Goodyear. They can be delivered virtually as well or telephonically. So if you have any partners that you can share that with, I'll try to get Kelly the link to the solicitation so you can help pass it along. Anybody else have any announcements to make?
I don't
Madam
have
Chair,
an
Vice Chair's hand is up.
it's not actually an announcement, but I was just thinking of a future agenda item, because some of us do roll up or brief the policy committee. I'm wondering if you could give us an overview of what they do and what their point is and what they like to focus on, because if it is going to help us maybe look at some agenda items that are a technical piece, or if we feel like maybe they're missing some information, or somebody out of this group is working on something that's relevant to what they're looking for, I think if we could get an overview on that might be helpful.
We would be happy to either invite the chair, or we've also been asked in the past to provide an overview of what the MAG Human Services team covers, because we do have a pretty wide variety of social services that we work on as well. And so we would take your direction and be happy to do that.
Just knowing like what policies they're trying to actually work on would be helpful to hear, because if there's information we can help share or that can help guide the policies, I think would be good for this group.
Mm-hmm.
Super. We will be sure to follow up with leadership on that committee and come back to you at the next meeting.
Thank you. Karen?
Thank you. So I just wanted to share with everyone, MAG had actually helped us in getting some information out recently. We have created a survey for Chandler residents and other stakeholders invested in the Chandler community to revisit all of our goals and priorities from our 5-year consolidated plan, and in preparation of our annual action plan for this year. We just wanted to revisit that. That comp plan was developed pre-pandemic, so we felt like it was worthwhile to get input from the community before we started pulling together our goals and priorities and our funding recommendations that'll be included in our annual action plan. So anyone who is interested in getting that information, if you didn't see it through MAG, just reach out to me directly and I'd be happy to share that as well. Or if you have other avenues for distribution, we met with our commission last night. We had shared the areas in which we have shared this information, and they also gave us some additional ideas. So the more the merrier. We plan on closing out the survey at the end of this month.
Great job, Karen. I saw it and I thought, what a brave woman you are for casting the net that wide. Anxious to hear back from you on how that works. And kudos to you for really taking the citizen participation component seriously and the consultation piece. So good job.
And as a Chandler resident, I'm going to fill it out, Karen, just so you know.
Please do. So feel free to put it up in other areas that you are able to. I know it wouldn't be in the town of Gilbert offices, but you know. But we are supposed to collaborate with bordering communities.
That's right.
So
No,
it's really good.
seriously, you're really doing what you're supposed to do. So good job. It's
So,
really brave.
well, thank you. We have actually gotten a pretty good response, but we're looking for more. So I'll be interested to look at those final results. And of course, we'll be sharing those and they'll be out as part of the public comment process. So take a look.
Would love that. Thank you.
Madam Chair,
Anything?
I have
Yep.
one additional announcement very quickly.
Yeah.
We are in the middle of Teen Dating Violence Prevention Month. You may have seen or received a list of those webinars. We do have another one starting at 4 o'clock. It will be our third of 6. We would really encourage you to promote that within your cities if possible, or within your jurisdictions if possible. We're looking for youth, individuals who work with youth, and parents to participate. And if they can't watch them while they're occurring, they will be recorded, and we're going to put out the YouTube link with this series as well. It's with our partnering agency, Bloom 365.
Awesome. If you remember, can you resend just about that to this group? It occurred to me I might be able to share that with our youth commission.
That'd be great. Yes, I'd be happy to.
Yeah. All right. Anybody else? Or a motion to adjourn?
Motion to adjourn by Gilbert.
Second. Susan, is your nod counting as a second?
I will second.
There you go.
Awesome. All right. Well, then we will, assuming no one is opposed, we'll see you all in a couple months, but let's stay in touch